All right. CRPN Central, this is Dr. Fox. Please like, comment, subscribe. It helps the mission more than you know so that I can do more for you. I sound pretty nasally, right? Yeah, there's got a little bit of a head cold here. That's okay. Doesn't keep me away from all of you. So I can be here to support you. Whew. Another interesting couple of weeks. I've been traveling to a site. I'm the interim director of that site. And I've got an interesting story for you. So, uh, to travel to my site, I have to connect to what they call one of the busiest airports in the country, in the U.S. And that's their claim to fame. We're the busiest airport. You hear the recording from the mayor when you're going through the airport. Welcome to the busiest airport in the United States. We have all of these planes taking off at all this time. And that's their big claim to fame. They're super busy. That doesn't mean that the quality's there. So I was sitting there waiting for my flight, huge connection. And all of a sudden, bam, thud. Oh my gosh, what happened? I look over and someone is laying on the ground. They face planted on the hallway. Boom, on that hard floor. They just face planted. Bam. I think they broke their nose. So they're gushing, they're gushing. Their nose is gushing blood. And a lot of people are gathering around. So I go to a gate and I say, "Hey, we have an emergency. Someone is on the floor and they are bleeding a lot." And I kid you not, my friends, someone comes up from the gate and they say, "Oh, hold on. I got to make sure this is an emergency." So they go and they take a look at the situation and they say, "Wow, yeah, I guess they are bleeding a lot. I think this is an emergency. I got to make a phone call." So they made a phone call and a security guard came up and he takes a look at the situation and he says, yeah, I think this is an emergency." So then the security guard makes a phone call, and there's this manager that comes up, drinking a soda, looking at it, and saying, "Ah, I think this is an emergency. Maybe we ought to help this person." Finally, 35 minutes later, this person who's laying on the floor hemorrhaging profusely gets a chair, not from airport personnel, but from another traveler who has a chair, who has them stop. They say, "Stop." He gets out of the chair and he says, "Give her my chair." And he goes over to the seats at the gate and he sits down. There were travelers who were going to the bathroom and grabbing paper towels and trying to help this poor individual. So most of the help was a result of the other travelers. And for 35 minutes, that's all there was. There was a chaplain holding the hand, and then there were just a bunch of management personnel deciding if it was an emergency until finally, thank goodness, the ambulance comes up from the gate. The ENTs come out, they take a look, and they say, "Well, you're not bleeding anymore, so here's a band aid." And then they walked off. Wow. Wow, everyone. Just wow. So, as I was traveling through this airport, I had a realization. I had assumed that the busiest airport in the world had the processes and procedures in place for my safety, and I think I was wrong. So, if anything, my advice to you out there is when you are traveling, you may want to consider bringing your own first aid kit. You may really want to consider taking care of yourself because even when you go through the busiest airport in the country, your safety is not their concern. That's kind of the conclusion that we all came to as we watched a system fail someone who was in need. So take that with a grain of salt. I'm not going to name any names, but if you're ever around the airports and you've had experiences like that, I'd love to hear about it. Let's understand like, how in the world do you prevent this from happening? What procedures are in place? There's defibrillators on the walls everywhere, but there wasn't a first aid kit in sight at all. So I hate to say shame on you airports, but come on, guys. There's patient safety at risk here. All right, welcome to TrialSide Chats, the place where we go through the industry one at a time, one question at a time, one concept at a time. And we are going to go through here each time and try to help each other out. So, full disclaimer, I'm not a lawyer. I never said I was a lawyer. And please feel free to watch this at your own risk. I really want you all to know that this is in our best interest. This is just a culmination of experience. This is designed to try to help people navigate the chaos that we call clinical research, just like a busy airport. But if you ever need a lawyer, if you ever need an attorney, in my opinion, one of the best attorneys in the industry is Edie Edens, Edie Life Science Law. Give Edie a call, and Edie can be there as the official attorney who can help to walk you through things that I'm not going to cover on this podcast. She's seen a lot of things and she'll take care of you. So, by reading this disclaimer, please watch at your own risk. If you take any ideas, do it at your own risk. If you don't agree to this disclaimer, turn the video off now. I don't need the views, but I need you to be safe. All right. So, we're going to talk about anything finance. We're going to talk about very, very sensitive subjects. Everything must be confidential. We're not going to name names. We're not going to point fingers. We're only looking at concepts so that we can talk about best practices. And admittedly, I put it out on LinkedIn, but man, this would be the day where if someone wanted to come on to TrialSide chats to have a conversation, I would really, really welcome them here. Not feeling so hot, but I want to make sure that we can produce this content for everyone out there so that you can do research in your communities. All right, icebreaker. So, this happens a lot. Do I have to accept these booster calls? They are taking a ton of time. Yeah. So, what's a booster call, everyone? So, a booster call is essentially a badgering call from sponsors and CROs to sites saying, hey, you're not enrolling anyone. What's up? It's supposed to be an encouragement call designed for sites to have conversations with sponsors. Sometimes it can be productive, like maybe sometimes sites have enrollment challenges that are out of their control, like inclusion exclusion criteria, things like that. But most of the time, it's pretty much just, hey, you said you can enroll this and you haven't. What gives? What needs to be done to help? It's kind of turning into one of those accountability calls, and it happens to sites a lot, especially if they haven't successfully enrolled. But importantly, um, do you have to accept them? So, one thing to note that uh, a lot of people don't realize is that when you have these booster calls, you're dedicating staff time to sponsor and CRO staff in an attempt to talk about enrollment. But at the same time, the time that's being taken away from you for booster calls prevents you from screening patients. It prevents you from actually screening. So, what's the point? Um, there's one thing that I should note about these booster calls is uh, odds are sites, if you accept these booster calls, you are the only ones on the call who are not getting paid for it. That's one thing to consider. It's a billable hour for a CRO. They're going to get paid for it. And they're going to sit there and they're going to tell you, oh, well, this is a paid service by the sponsor. It's free to the site, but it's not really free. The hours that are taken as a result of these booster calls, you really got to watch them because they can add up. And then you have some sites that, it's we're just going to invite everyone into the call. All of our staff members are going to go to this booster call. Do you realize how many hours and hours are spent on a single trial for this booster call when your staff should be focused more on recruitment and not just for that one trial, but overall recruitment? Dollar for dollar, pound for pound, a booster call is not cost effective. And if a site is productive, this is something that can really drain their time and reduce their productivity, which is actually kind of counterintuitive if you think about it. Answer is no. So there's a couple of ways that you can address booster calls. The one that I generally cover is I'm sorry, this isn't in the contract. This booster call is out of scope of the service. And if we can't find a way to bill for the booster call, then I'm sorry, but we're not going to have the booster call. We're just going to focus on scheduling patients. CROs don't like that because you're cutting in on their billable hours. But I do want to encourage you sites to really accept booster calls if you think they're going to help and if you think it's worth the investment. But I do want you to know that you are investing resources into it. Many times, sponsors will say, "Hey, thanks so much. We'll talk to you next week." They want weekly booster calls. Quantify how much that is costing your site for the hours of work that are not performed actually doing the work, but rather talking about not doing the work. Go figure. So, anyway, what is your experience about booster calls? How do you address it? I'd love to hear from the audience on this one. All right, so today we're going to cover the book. There's the book right there. Here's the physical copy. The QR code sends you to Amazon. You can buy it on Amazon. If you want to contact me, we can give you 10% off the cost of the book plus free shipping. And pay attention to this. There's going to be some changes on how you can access this book relatively soon. And there's some future to this book. So as we continue, I just want you to know that this is not static. This is an opportunity that is probably not going to be there forever. All right. So we just got through the feasibility questionnaires last week. We talked about the surveys, we talked about the processes. And let's say that you filled out a feasibility questionnaire that the sponsor and CRO really like. Well, now we go on to the next level. Ooh, this site looks interesting. The numbers are all matching. They're all saying the right things. It looks good on paper. I guess now we have to see if they're legit. If we have to validate what we found during our feasibility during a PSSV, a pre-study site visit, or a site qualification visit. It's kind of like, you know how you fill out a job application and you put all this information in the job application and then you get called for an interview. And so you have to go talk to people about your job application, but also kind of learn a little bit more about the job and also let them learn little bit more about you and your personality and how that works. A PSSV is kind of like a site's job interview, so to speak, where they're going to have people most of the time come on site. It's a physical experience. They're going to come on site. They're going to ask some questions. They're going to gather some information, and they're going to take a tour. They're going to look at things. And then they're going to make a determination on whether or not they want to continue working with you, whether they want to award you a trial, or whether it's not a good fit. Whether it's from a site's perspective, it's not a good fit, or sponsors and CROs, they'll know once they set eyes on your site. So, excuse me, it's cough drop. This is the initial physical, most of the time, physical interaction between sponsors and CROs and the site. It assesses the site resources for potential trial performance. Sometimes they'll look at the facilities themselves, they'll look at your processes, your SOPs, they'll look at your logistics and if you can handle their trial. And then it also gives the site a chance to ask questions to determine if the trial is a good fit for their site. Not every trial is a good fit for a site, everyone. It's not, one fits all. Sometimes there are trials that just don't work at certain sites. And this is a great time to determine that. So generally there are 3 objectives in a PSSV. You want to talk about the opportunity. You're going to ask questions. Well, both stakeholders are going to ask questions and then you give a tour. And those 3 are the primary functions of a PSSV. Now let's talk about the opportunity discussion. So generally in a PSSV, oh, Katie, hello, how are you? Katie says, for the first topic, we get a lot of CTEs wanting to book on-site meetings. Might have to start using the fact that we don't get reimbursed for them. Yes, Katie, I'm from Missouri, And so I always call it the show me state. Generally, it can always work out as saying, hey, I've scoured the contract. I don't see anywhere where we are paid to perform this service or to provide this time. It seems like it's out of scope. Could you please show me in the CTA where we're going to get paid for this? And then once I know how we're going to bill for it, then I'm happy to schedule it. And generally what will happen is they'll come back and they'll say, oh, this is a free service by sponsors. You don't get paid for it. And you say, well, if we don't get paid for it, then I can't dedicate resources to it. And then they either back off or they go to their managers and they get approval so you can get paid for it. So one or the other, you win. Very, very good comment, Katie. Thank you. Okay, so in a PSSV, generally it starts with, of course, we're going to schedule it. I've had 6-hour PSSVs. I've had 1-hour PSSVs, somewhere in between. There's a section where everyone kind of sits around and talks over a PowerPoint slide presentation about the opportunity, being the trial. And then after that, there's a series of interviews, ability interviews. Show me your SOP manual. How do you do this? What do you do that? Are these your capabilities? Can you accommodate this or accommodate that? There's always those kinds of questions. So that's the discussion itself. Is first, make sure that you have read the protocol synopsis. Make sure that you know what we're talking about. And odds are, for a really successful PSSV, you really want to make sure that you've done your homework. The more questions you have, the more interested your site seems. And the more likely the sponsors are going to sit there and listen to you. They'll be like, oh, that's a really good point. We never thought about that before. Really, really good to be prepared. And then be prepared on, once you've done enough PSSVs, you kind of have an understanding of what the sponsor is going to ask. You'll see a trend. There's always the 3 token SOPs that you'll have to provide every single time there's a PSSV. PI oversight, informed consent, and disaster preparedness. Those 3 almost every single time. Sometimes, depending on if there's decentralized trials, DCT, you'll have to show a protocol on that. If it's like an inpatient trial, I don't know how many of you do inpatients, but you'll have to have entire inpatient protocols for that. But the one thing I should say is, before you start literally showing your company's secrets and your processes, make sure that you have a confidentiality agreement that protects your proprietary information with the sponsor. I wouldn't give that stuff away without really protecting its sites. That's something that you might want to consider when it comes to having PSSVs, and make sure you have a 2-way CDA or NDA on file before you start giving this information away. Really, really important. All right, and then the questions come. Here's the big PowerPoint slide. Here's the questions. So these are questions that sites can generally ask the sponsors at the PSSV. And mind you, most of the time, this information wasn't in your feasibility. You're going in here blind. You have no idea what's happening. What kind of software portals will be used throughout the trial? Operations reg admin. What kind of technology? What's the tech stack? You're not going to know that before the PSSV. They don't provide that. And sometimes, honestly, during PSSVs, they don't even know it. They don't realize like what things are. Sometimes they try to do PSSVs and site selection parallel to development, which means that they're still figuring it out. But it's good to have those in place, especially when it's an understanding of best fit. Like, let's say there's certain technologies, there's certain CRFs, certain portals that the sites are finding are very, very troublesome. They're going to have to understand that for a best fit determination. What couriers will be used? Oh my gosh. So not all courier is the same. There are certain couriers that are always problematic. And so if the sponsor has selected a certain courier, it's going to be really important to know that as a site, to understand if you can handle those logistics. Never mind. I'm not going to name names, but I've seen the good couriers and the bad couriers. And I will tell you right now, if you just ask the question, who's the courier that you're working with? If they give you an answer, it gives you an idea of what kind of a trial experience you're going to have, sites. Katie says, for the CDA, have you seen that sponsors and CROs always send a one-way CDA first and you have to request a mutual one? It's so frustrating. Yes, Katie. 99.9% of the time, you will see one-way CDAs that are sent to sites. It's going to be a confidentiality notice that has the site agree to protect the confidentiality, the confidential information of the sponsor, like the IP, the drug, the information. But it's often by very special request, mutual, two-way CDA, you have to push back and say, hey, no, we need a mutual CDA. Please send it back. Every single time it's going to have to be upon request, which tells me how many times sites just volunteer their information to these sponsors. All right. We have, okay, so it's kind of like technology, but then this is where it really gets into the weeds of it. What EDC are we using here? Is informed consent technology? Can you accept site informed consent technology, or do you require one by the sponsor? And what IRB are you using? Likely a central IRB, but which one? That gives the site the ability to understand the logistics. Most of the time in a PSSV, I've always heard the sponsor saying, okay, are you comfortable with working with this IRB? What IRB is this for? Is this IRB? It's part of the questions that the sponsor will ask just to make sure that the site already has like a registration with this IRB, or if the site is already capable of working within the IRB. That may also extend the timeline if it has to be like a new submission or a new registration. And finally, one of the big things for a site to understand is what kind of resource load, what kind of burden is this going to be on my site? In other words, what's the enrollment goal? How many patients do you expect the site to enroll? And if they have it, what is the screen fail percentage? The projected screen fail percentage is something that they're going to have to do anyway in the DSMC so that they can understand the power of the trial. They're going to know if there's like a 50% screen fail ratio, if there's a 25%, whatever that is, they're going to know that. But many times, sites, you're going to have to ask that. You're going to have to say, hey, what's the percentage of screen fail that you anticipate? How, like, what's your targeted enrollment based off of that power? And as a result, how many sites do you plan to select? That's important. And there's the basic math right there to let you know what your targeted enrollment goal will be, and then how many patients you are projected to enroll to meet that enrollment goal based off of the screen fail percentage. So, very, very important question to ask during your PSSV. And finally, the tour. So, the tour is super important, and you can actually have this like down to a protocol. You need to, as a site, point out very, very particular things during your PSSV tour to show the sponsor and CRO that you know what you're doing and that you're running a tight ship. Number one is you always pay attention to how IP is locked. You want to make sure that you're at the very least double locked and stored in temperature controlled environments. What do I mean by temperature controlled environments? Well, you start with ambient, and then you go to refrigerated, then you go to frozen, and then you go to -80. Those four are going to be the environments that you can control. Those four for IP, depending on the schedule of IP, you're going to have a schedule 1, 2, 3, whatever that is. You may have to have, like, for example, a schedule 1, you may have to have like a refrigerator or a safe that's literally bolted to the floor with its own lock. So it's like a quadruple or a quintuple lock on the access to the IP. But at the very least, most of the time, sites, if you have like a controlled environment, like let's say you have a fob that you open up to get into the main site area, that could be lock number 1 because it's restriction. And then you could have another layer of protection in the IP room itself. And then you can have like the cabinet itself being locked. So that'd be a triple layer of protection. So at the very least, make sure that you can count 2 locks that will have to be unlocked to access the IP at the very least. The higher you go into control, the more locks you're going to have to add to that equation. It's not required yet, but it's always a really good nod to quality when sites have some form of backup generator on all of their electric temperature control devices, refrigerators, and freezers, not just for IP, but also for sample storage. So, um, it depends on the building, but they've gone really, really well with certain devices that you can plug in. It can just be an inline battery generator, whatever it might be, some form of backup power for your areas is a really good nod of quality from a CRA. I also just went to a PSSV just recently, and they finally announced that they are moving to the requirement to have temperature controlled areas at 24/7 monitoring. So, for all of you sites out there who are still doing paper documentation of temperatures, maybe like once a day, you skip the weekends, that kind of a thing, sponsors are changing. The industry is changing. It is so easy to get a 24/7 temp backup monitor now, or a temp reporting system with excursions and emails and all of that, that if you don't have that at your site yet, you really should just start with it. I would not focus on having paper logs anymore for this industry. They are starting to move toward the requirement for 24/7 monitoring and excursion prep. Do not put heat generating items, specifically like tech, IT, things like that, in the same room as your IP. That way, you're compromising ambient temperature. You could be, especially if it's a small room, like most sites, they'll end up having some like server room, little closet, and then they think it's a great idea to, because it's just they have the space, they'll put like their IP cabinet in that closet. Not a good idea, friends. Not a good idea. And I guarantee if you have 24/7 temp monitoring, you're going to see some pretty substantial increases in temperature as you go through that. So try to separate certain parts of your site as you go. Make sure that you have exam rooms that are private, that you can have conversations with your patients in, so that you can do informed consent properly. You really need to be in a private room when you do informed consent. The busy clinics have been dinged the most because they don't have a clinic room, they don't have an exam room, and so they literally just do informed consent in the hallway. It's not a private area, and everything can be heard by everyone around there. Not a good idea. If you want quality, make sure that you have the ability to have a private conversation with your trial candidates. And then finally, if you really want to impress the CRAs, I'm telling you this right now, sites, it's worth the real estate to have a dedicated monitoring room. And I don't just mean some kind of a broom closet with a desk in it. I mean something that is capable of having, if you're eSource or eReg, you have a dedicated computer system there, a computer station, so that monitors can view EMRs, maybe CTMS, eSource, computer stations. If you're still on paper, having a really nice room with a big table so you can spread out the folders and you can stage for a monitoring visit at any time. You can have a place to discuss the quality of the trial as you perform it. That's just the icing on the cake. Most of the time, dedicated monitoring rooms also should have access to the ability to print or to copy and scan, because there could be some things that CRAs would want to make a copy of so they can take with them. Very, very common. So that right there is a big nod. CRAs are very appreciative of dedicated resources to help them to be successful in monitoring. All right, so that's the end of the lessons. So we're going to go through sections of the book one at a time. That was let's see. So we're at PSSVs. So what do you think the next one, well, the next part's going to be? What do you think we're going to be talking about? I'm not going to answer it today, but if you're going through the logical progression of a clinical trial after PSSV, what do you think we're going to talk about next? or what do you want to talk about next? Please feel free to reach out, ask your questions. I'm going to put the banner up here right now. Here we go. So there, if you have any questions at all, or you want to make comments about TrialSide chats, if you have any content that you want to request, here it is right now. Send your questions. LinkedIn, YouTube, you're welcome to email. We're happy to receive those questions and answer them. All right, let's talk about case studies. So this happens a lot. Do I have to send my SOPs to the sponsor as justification? This is very common sites when you have certain policies that you're citing during negotiation where the sponsor is going to pretty much call you on it. They're going to say, like, let's say if you say we have a financial ethics committee and the financial ethics committee has to review every trial to make sure that it is financially responsible. Well, they're going to come in, they're going to say, well, show us the SOPs that say that you have to use your financial ethics committee. Stop. Talk to the hand. So it's okay to have internal SOPs that you do not share with the CRO or the sponsor. I 100% guarantee you that CROs and sponsors have SOPs that they are not willing to share with you, that they exercise on you all of the time. Escalations, certain communication plans, how the site vetting, the RFP process, all of these things that sites are a part of that they have zero visibility into as far as SOPs. And it's okay, sites, to do the same. You can easily, and this works all the time, every single time. I've never had it not work. You can just tell the sponsor, I'm sorry, but according to our SOPs, we can't provide this information to you. It's proprietary knowledge. It's internal only. And then they're going to say, well, show me the SOP that says that. And you're like, really, dude, this is like a giant loop. But eventually they back off because they know that they can ask you for the documents, but it's perfectly okay to say no. And I've never seen telling a sponsor no to sharing your internal SOPs as being a deal breaker for a sponsor. I've never, ever seen that happen. So answer is no. You do not have to send your SOPs to the sponsor's justification. Now, in fact, given what sponsors do with your SOPs, in other words, they share it with other sites, you may have just given away your competitive edge. So I wouldn't. I would just say no. That's against our SOPs. I don't share this. I'm sorry. All right. True story. This really happened. So CRA came to the CRC and said, hey, we're ready to close out your site. The CRC says, oh, okay, how's next Tuesday? They scheduled the site for the CRA. The CRA performed the closeout, just ninja closeout, boom, like that. And the site had to write off over $50,000 in unpaid bills because now the site no longer has the leverage needed to hold the sponsor and the CRO accountable. They're still waiting on that money. It's been years and they're not going to get it. That's all there is to it. So sites, if there's no way that a CRC is going to possibly know how much money a trial owes. That's not within the scope of a CRC. And that's for many, many different reasons. Most CRCs do not have visibility to the contract. They do not have visibility into the finances. They're focused on the patients. So the CRC or the PI will always be that go-to person for a CRA to contact to schedule things like this, the life-changing moments of a trial. And so you absolutely have to interject communication plan with the CRC that no closeout is authorized by the site until it is cleared by the finance team. I know it seems like an extra step, but I have seen hundreds of thousands of dollars reclaimed by sites that would have been lost with this one step. So I would highly recommend the sites out there to take a really close look at your communication plan and ensure that no closeout, even no monitoring visit, will be approved until finance approves it, until they take a look and say, yep, sponsor CRO, they're clear, they're paying their bills, we don't have anything outstanding, go ahead. Or they're going to say, I don't know about that. They owe us a lot of money and we probably shouldn't give them access to data. So let's have a conversation. They should really fix this before they access it. And that's okay. All right. All right. Final one. I see one viewer here. Hello, viewer. I hope that you're still watching. Maybe it's Katie. I can't tell from the screen. So, Katie, what is wrong with this picture? So, I am a CRA and I am taking a site tour, and I see this in one of the rooms. What do you think? What's wrong with this picture? I see one room and has a couple cabinets of IP storage here. And then it's got the IT servers for the whole site right here in the same room. So what's wrong with this picture and why? What do you think is going to happen? I think we discussed it in the learning section of here, but I thought it might be good to have this conversation. So I'm not going to answer it. If you're watching this later, take a look, take a guess, or rewind a little bit at the very beginning of this video, and you'll probably have your answer. All right. So thank you so much for tuning in to TrialSide Chats, whether now or in the future. If you'd like to join CRPN as a site, it's free. If you'd like to join CRPN as a sponsor, you're going to save a ton of money and have access to, oh boy, I'll come back to that, Katie. Good job. You'll have access to some really high quality sites. Please feel free to check us out on LinkedIn and or definitely subscribe to YouTube. I think we're over 440 videos on YouTube now, all dedicated to quality. And let's go back to Katie. Good call, Katie. So Katie said, woof, with a room that has IP storage and IT servers in here, it's going to be awful toasty. Yep. You're spot on, Katie. So probably not a good idea. And I doubt you're really going to maintain ambient temperature when you're in a room like this. So probably worth paying attention to. Good job, Katie. Thank you so much. All right, so that's it. So connect with CRPN. There's the website to see what we do. YouTube, lots of videos. LinkedIn, we post all the time. TrialSide Chats is every 2 weeks for now, but I think we're coming closer and closer to going weekly again. We'll see how things are going. As of now, I'll be off on the site next week. So we'll see you in 2 weeks. If you have any questions, please feel free to reach out. This is Dr. Fox. Please like, comment, subscribe, share your voice. See you next time.